Module 1 Group Discussion, Types of Communications Between Professionals, with Abigail Whitehead, Citlali Irales, Kyra Tilley, Lakeisha Neal, and Patience Maura.
So I guess for the first question sorry, I'm hearing myself. Let me turn this down on my end. So what communication channels was Jan suggesting that Lucy use? So I guess the channel that she was asked Jan to use was the going directly to the manager instead of the charge nurse first. And I know during this module in the reading, it was about like the chain of command and, following the appropriate person to escalate issues to. And the charge nurse, I guess, would be like the first point of contact instead of going directly to the manager. Like, I understand the whole portion of wanting to go straight to the manager because I feel like that's how stuff usually gets taken care of. But when there's a chain of command, you're kind of delegating somebody else to follow up with it instead of going straight to a manager who probably has other responsibilities. What do you guys think?
That's what I put too. I put that she was using the diagonal channel, and Jane was suggesting Lucy use the diagonal channel because she thinks she should go straight to the manager. But I think it makes it hard because then it's like you're not respecting your charge nurse and you're going above her. So that can create conflict that way too. And I know like Jane was just trying to like help her like not get thrown under the bus, but I think Lucy's reaction was correct. That way she doesn't get in trouble with anybody else.
Yeah.
I was getting a bit confused because I was like, I know she's using the chain of command, but then I was rereading the question and I was just like, is she, I don't know, the question was a bit confusing me, but I know she was trying to use the chain of command, but then I'm like, she's skipping ahead. And I like how Lucy went back and told her like, she does have to follow the chain of command.
Mm-hmm. I know like more realistically, since right now I work in the hospital, your charge nurse is always pretty much on the unit, whereas your manager isn't always there. They're only there like during the day, regular 8 hours, stuff like that. So your first point of addressing any situation should be with the one that's present. And then if it needs to be escalated, then it would go up.
Yeah.
I agree that they did the like diagonal chain of command instead of what you're supposed to be doing. But I also saw what it was Jane, correct? That she was giving more of like an aggressive technique where she was like, oh, while you're covering all your bases, but it's more in her mind, it was kind of like making sure that Jane was more of a or Lucy, I don't remember each names, but that she was basically like winning over the other person. And that's one of the ineffective techniques from what I remember. And it's not going to actually help them. If anything, it's just going to make things worse by skipping the chain of command.
Yeah, and then your answer actually leads us into the next question, which is what is the communication technique that Jen used when talking with Lucy, which is that passive aggressive. Because she was very like pushy about like, this is what you should do, instead of, taking a more, I don't know, I guess persuasive, calmer demeanor.
Yeah. Essentially, they were kind of gossiping too, because like Jane wasn't present. It was just Lucy and Francine.
It's very one-sided, yeah.
Yeah.
Agree. And then I guess did you guys have any more on that question? Sorry.
Yeah, I was gonna say it did seem like the passive aggressive, it was honest, but like in in like if you looked at it in a different perspective, it was a little aggressive. But it was like, you know, she was trying to help her in a way.
Yeah.
I mean, that's what the passive aggressive it is. It appears honest,
Yeah.
but you're being manipulative.
So it's like manipulative at the end.
You're disregarding the other person in a sense.
Yeah.
And then question C is, what communication channels was Lucy planning to use? And then, so I guess it was just like going directly to the charge nurse instead of, you know, doing that diagonal and going straight to the manager. Which is honestly the best.
That's what I put too, that she was doing the continual one, which is the one where you do superiors and subordinates, because again, if she would have gone just to the manager, I think it would have like blown up into this bigger thing than it needed to be.
Yeah, she's essentially being the bigger person and more professional.
Yeah.
And then so she'll only get them involved if it came to that. So like she doesn't want to get anyone involved. She's just like whatever.
Yeah.
And I think there could have been also an additional, I guess, channel is she could have also just gone straight and talked with the nurse that she was having the conflict with, because I feel like sometimes when you have that one-on-one conversation, tell them like, hey, this is how I saw this, would also help it in a sense of not having to like escalate it further, because you can just go straight to the point. Like I know like right now at my job, I also work in healthcare. Whenever anybody's having any issues, and I'm always like listening in on my director's office, because my office is like right next to her, so I'm always like hearing everybody coming in to complain. And her first, even though she's the director, and like there's the charge nurse, there's the manager, there's the assistant director, and then they just go straight to her all the time, she always asks them, well, did you talk to that person first before coming to me, and then, you know, checking in with all the other people? So I think that probably would have been a good suggestion too.
Yeah, I think also, I feel like if she did go to her, since they had the first conversation, she would have been like more passive with it and just trying to like please her, not be like having like a difficult, like make a difficult decision. So maybe that's why it's like kind of avoiding it in a way.
Yeah,
so
that's
the
what I
conflict
think
doesn't get bigger.
Yeah, I think she was using the passive technique because she's basically ignoring it. Like she was just like whatever, like that's what's gonna happen. If it becomes an issue, then I'll go to the charge nurse. But other than that, I'm just going to let it happen. I felt she was being very passive in the situation when the other person was being aggressive. Francine was.
Yeah.
And then the last question is, what was the difference between the way Lucy communicated with the physicians on the phone and then with Francine and with Jane? So with the physician, I feel like she was very assertive. She was very informative about what needed to be done, and, you know, giving all the information that in regards to the patient to the physician. And then with Francine, she was very passive. And with Jan, she was pretty assertive once you told her like, this is what my plan is to continue on with this.
Yeah, she's very clear and respectful, and even though she disagreed, she still like went with Francine's requests.
Yeah, I also think with the physician, she used the S bar. I think they had like the part that was an I included, but I know I wrote down the S bar was like, you know, situation, background, assessment, and then what she was recommending to the physician.
Yeah.
She used the appropriate tool to go on with the physician to pass on the information.
I agree.